I am, before I get started, I am flanked by some incredible people. As many words I'm about to share with you, I want to give the credit to the people you see standing to my right and standing to my left, because between community development and the folk you see here, they're actually on the ground doing the work. And so the frame of this is very simple. About 350 individuals are currently unsheltered in our city. I want that number to sink in. That's 350. They need a lifeline. They need a bridge and a beacon of hope as they are facing some of life's most difficult challenges. Today, we're proud, so proud and excited to announce that Heart Birmingham will be just that. The work of this homeless outreach program reflects the kind of city we want Birmingham to be. One where dignity is upheld for every individual, they're valued, and where we refuse to turn a blind eye to the struggles of our fellow residents. Truth is, because they need us. And so by addressing homelessness proactively, we reduce strain on emergency services, we improve public spaces, and create opportunities for meaningful engagement and connection. But I want to make myself clear, and I know the folks standing here agree with this. Tackling homelessness is not just about programs. It's not just about policy. The most important thing it's about is people. The mother looking for a safe place for her children to sleep. The veteran who served this country and deserves respect and care. It's about the individuals who are ready to take the first step towards stability in their life and needs help getting there. We believe that's part of our job. So the City of Birmingham works with multiple agencies. So just to give y'all some backdrop, we work with multiple agencies that provide a comprehensive public-private effort to address the needs of our unhoused population. The city's overall vision is quite clear. It is to create home options for all Birmingham residents. There are several affordable home development projects in the works across the city that you all are aware of, as well as programs for down payment assistance, lead abatement, as well as the critical repair program that we've been doing for years. But especially around the Birmingham unhoused population, the city supported the construction of the firehouse shelter facility. Recall, that was to the tune of $1 million. We also supported the AIDS Alabama Way Station facility for youth, and that was to the tune of $1.3 million. And each year, if you're unaware, the Department of Community Development administers right at $800,000 in federal grants to support emergency shelter. And so again, through public-private partnership, we continue to assist individuals experience homelessness. Just to close out, the city partners with Jimmy Hill Mission and other community providers to open a warming station. As you know, that's open this week. For those needing space and needing a warm place to stay, I think it's critical we assist those in the immediate need, particularly dealing with sub-freezing temperatures. Through the Birmingham Reentry Alliance, the city and multiple partners also support reentry of individuals after incarceration. Why is that important? Because as citizens transition back into our city, their needs and services, including for housing, is so important. And that's been a one-year pilot program that puts us in the best position to transform how the city serves those transitioning back into our community. Look, that's a lot of words, but I thought it was important to tell you what we have done, what we're doing, and at this point, Heart Birmingham and the many other programs we support remind us that the measure of a city isn't just our city skyline or businesses, but it's how we treat, how we engage, how we support, how we invest in our most vulnerable residents. Birmingham is a city that cares. And so at this time, I'm going to shut up. I'm going to stop talking, and I'm going to allow one of my bosses to come up here. And that is Dr. Megan Venable-Thomas, who leads Community Development Department, to give you more information about Heart Birmingham. With that, thank you all so much. Madam.
Thank you. Good afternoon, everyone. When he said his boss, I said, well, who's going next? I thought it was me. I am Megan Venable-Thomas. I serve as the Director of Community Development for the City of Birmingham. And we, again, are really excited about the HEART program because it's not just a program. It is part of a comprehensive approach to how we're thinking about increasing the accessibility of housing across the communities, across the spectrum of needs in our community, and really centering our most at risk, providing choice that turns housing into home and supports community building. And so how are we doing this across the city? As the mayor mentioned, we're building more houses and supporting existing homes, which is critical to that. But we're also meeting people where they are. From micro shelters and places that ensure safe sleeping for our neighbors experiencing homelessness to permanent supportive housing or those transitioning from some of the most challenging times in their lives to senior housing for our legacy residents to home ownership for those ready for the opportunity. Wherever our residents are in their pathway to home, we want to provide options to that journey. We're also shifting culture. We all deserve a place to call home, and yet we don't all have one. And so it's our responsibility as a people, not just as a city, to create opportunities and radically welcome those seeking community. And we all play a part. So no individual or community or organization or initiative can change the trajectory of Birmingham's health and housing alone. And lasting change will not happen overnight. It will take collective engagement and unprecedented coordination between the public and private sectors. That is why our strategy focuses on collaborative opportunities with nonprofits, corporations, institutions, and people touching different aspects of health and housing. And so we identified a need, and we're filling it with this program. More than 4,200 calls to 911 and 311 are concerning unsheltered citizens and those who are in crisis. So we found that need, and we wanted to fill it with an opportunity in seeking an organization to provide outreach, engagement, and call center support that would allow for real-time, innovative, multi-agency problem solving and referrals for those experiencing homelessness while reducing law enforcement and fire departments' call volume. So we put out an RFP in February of 2024, and we evaluated all the folks who applied on a number of criteria, and we selected Urban Alchemy not just because they had experience, but because they had heart, which is a real key component of this program. We've also seen that successfully they operate in San Francisco, Los Angeles, and Austin. The team has seen high success in de-escalating situations, connecting people to resources, and making neighborhood residents, housed and unhoused alike, feel safe. So again, this is one notch in our comprehensive approach to how we are supporting some of our most vulnerable residents, but ultimately how we are supporting safer, healthier community for all Birmingham residents. So I'm so excited to pass the mic to Urban Alchemy to talk a little bit more about the program and what we'll all be able to see here soon in our community. Thank you.
Hello everyone, my name is Artie Gilbert. I'm the Director of Operations for HEART Birmingham Love. I moved to Birmingham in November, which makes me an official resident. I'm doing this line of work and outreaching to helping people who are experiencing homelessness is a great deal to me and my team. We have a lot of passion. Now that I'm a resident, I have even more passion to be involved to helping people to find resources, and not just to relocate or remove anyone, but to help them to get adequate resources, housing, something to eat, showers, and those sort of things. I'm going to close out on that and pass it over to my teammate, Tori Miles.
Good morning, everyone. I'm Torian Miles. I'm a proud member of Birmingham's HEART team. I come out of the community as well, experiencing hardship and uncertainty, and this is a great way to not only give back, but give hope. We plan on transforming our communities through empathy and compassion, most of all, with aligning them with the right resources to not only become stable, but to heal whatever it is that put them in a situation in the first place. Again, I'm just really excited and proud to be a part of such a great big movement, and thankful for our team directors and getting our work done. But pass it out to you. Oh, that's it.
Yep.
Ask the director any questions.
Yeah, any questions, as the boss says.
Well, sir, this week we talked about extreme temperatures that we're going to be experiencing. It's going to be quite cold out there. Is our mission and our goal to focus on getting people shelter and possibly permanent housing as we launch this new program?
Well, since I've been out here, we've been a part of and participating with the warming station with JHM. We can't just say that we want to just get people permanent housing, but that's our wish, that's our goal, that's the ultimate goal, yeah.
Who else?
A lot of people would, I got it. When I've done stories and talked with homeless people, a lot of the times they struggle with mental health issues and stuff like that. Can you talk about some of the initiatives you have to address those issues?
Right. So when we start our organization, when we start our programs, we start off with a series of trainings, de-escalation, conflict resolution. So we implement that in our line of work. And when we go out there and we identify someone who's experiencing some mental crisis, we are very sure that if we can come with some items like socks, water, food, and those type of sort of things, we can possibly help them to be escorted to some type of resource.
As we begin to launch this program, are there certain areas in the city that we're specifically focusing on or trying to target more?
Well, we have a few spots. We're still working on it. We're still drawing out the grid to make sure that we can identify the hot pockets and hot spots with people who are experiencing homelessness, which we call guests. Yeah.
What specifically will you guys be doing? You're not running micro shelters, correct? You're handling the 911, 311 calls involving someone that's unsheltered or experiencing a mental health crisis?
Right. So we're going out to do the outreach in the sense of taking a pad and drawing out what we call a ticket to identify who the person is, the last time that they've slept on the street, their experience of homelessness, and where's the best fit that we can support them with the adequate resource.
So it's essentially outreach.
Yes, essentially outreach.
Answer all the questions. Anybody else? Well, we want to thank y'all for your time. Thank you so much.